There's a turf war going on over your face. Some 30 states have expanded what's called the scope of practice for oral maxillofacial surgeons, allowing them to do cosmetic procedures beyond the mouth area.
And that's got plastic surgeons up in arms. In depth tonight, the arguments for and against this change and how it would affect your life.
I was certainly rocked when I heard about what was going on in New York State with the dental scope of practice.
Dr. Lucy Chapik is a plastic surgeon whose work usually involves recontouring faces. Now she's drawing a line about who should and shouldn't be allowed to do the work she diligently trained for. Troubling enough, says Chapik, that doctors other than plastic surgeons are offering Botox, facial fillers, and liposuction. But now that highly specialized dentists, known as oral maxillofacial surgeons, want to be able to do elective plastic surgery, enough's enough.
To me, this is about patient safety, patient education.
Chapik says in states that have expanded the scope of practice, problems with shoddy work are occurring, even in New York, as non-plastic surgeons branch out, basically to expand their income stream.
I've seen numerous patients with disfigurement, facelift scars placed incorrectly.
Oral maxillofacial surgeons have always done skeletal surgery on the face.
Dr. Lawrence Buccino is an oral maxillofacial surgeon, OMS. He spent his career reconstructing faces damaged by accidents or disease and correcting congenital defects like this. He says the battle over who can do what is nothing new.
This has been an issue in New York State for the past 20 years. And is it a turf issue? Absolutely.
But times have changed, and Buccino says part of the problem is that New York's Dental Practice Act hasn't changed since the 1940s.
The training programs have kind of outstripped what New York State law allows us to do.
And that, says Buccino, is something the plastic surgeons in New York State Medical Society are missing when they tout their training, dismissing the OMS training as inadequate.
So you have four years of undergraduate school, you have 4 years of dental school, and then you have 4 to 7 years of hospital residency training.
Additionally, some OMS practitioners now get a joint DDS and medical degree. The sponsor of the bill generating the controversy is Senator Jeff Klein from the Bronx. He says it's really not about allowing OMS practitioners to do more. Rather, it's about where the work can be done. In a statement, he says the bill simply expands their scope to allow for these procedures to take place in an office setting by those dentists who meet specific criteria and have the appropriate credentials. The Klein bill passed the Senate last year, but the Assembly didn't take it up and still seems loath to act on it. In the meantime, Buccino and Chapik share some common ground, agreeing that general dentists who provide Botox or facial fillers beyond the mouth is not appropriate. And if they're doing it from the nose up, are they skirting with
They're probably skirting with the law. Yeah.
And they remind us to always check the credentials and training of the doctor we select. There is a website that you can go to check on the qualifications and your doctor or dentist. We've set up a link. Just go to WNYT.com. It's an interesting argument, the one that won't be settled very quickly, but something that we as consumers have to be aware of.
That's a turf war I was not aware of. Interesting.
Yeah. Well, the Thanksgiving Day forecast.